So, welcome back to the centre, both Mick and Maz. We're here to support Head and Neck Awareness Month, which is April. So, thank you both for joining us here today. If I can come to you first, Mick, I know you've spoken quite a lot about your diagnosis and the effects on yourself and some quite important messages. Just for me to understand just a little bit about your when you were first diagnosed, and then moving on to kind of the support that you've had around you during your cancer diagnosis.
The most important word in what you just said there is awareness, I think, and my diagnosis came in February 2023, but the important thing really to talk about was the back end of 2022, which, if you cast your mind back, that was we were just coming out of COVID, and through sort of November, December 2022, I sort of had flu-y symptoms. And you know what it's like when you're a bit under the weather, you say, "Oh, my glands are up," you know, and that was what I thought. By the time it got through beyond Christmas and into the new year, any flu type symptoms had stopped. Yeah. But hang on, there's still a swelling there, and I realised with hindsight, I think, Maz, you'll correct me if I'm wrong, that what this really was my lymph nodes coming up, which was an indication of something worse. So that was what really alerted me. So I went in, I guess early February, I think I went and got went to see the GP, got put on the 2-week pathway. Yeah. And then that was the beginning of everything. The treatment was 30 courses of radiotherapy and 5 of chemo during May and June 2023. And Maz, as my radiotherapy consultant, saved my life, as I like to say, effectively to this point. So he's the man to thank.
Okay. Maz, tell us a little bit more about your role as a consultant therapeutic radiographer.
So my role as a consultant therapeutic radiographer, these roles are quite new but upcoming in the country due to lack of oncologists. I support the patients from diagnosis, so when they're referred into oncology, I'll see them, make sure they're aware of their diagnosis, and present them with their treatment options from the MDT discussions which we have with the various members of the MDT, being surgeons, ENT, MEX, VAX, oncology, and then our CNS team. And from then, I would plan the radiotherapy, and on treatment, I support them in a weekly treatment review clinic I do on a Tuesday. So symptom management clinic to ensure the patients go through each week of treatment to manage, and then post-treatment, I follow them up to 5 years.
Right, okay. And in terms of head and neck, what brought you into the speciality of head and neck?
So I'm always up for a challenge, but going back from my youth, we've had a few people in our family who've unfortunately had head and neck cancer and passed away. So that's always drawn me to head and neck.
Head and neck. Yeah. Thank you. It sounds a really interesting role, and that support that you give to patients at those clinics, and then sort of 5 years afterwards, really. Mick, what has been sort of your sources of support and help during sort of through treatment and after treatment?
Really could not have got through it without the sort of close support of my wife Nikki, and my, fortunately by now, adult children, because that is the most important support. I think at one point I had something like 22 different medications or treatments that I had to take during a day, and there's some you can't take within an hour of the other ones, and there's some you've got to take at least 2 hours for the other ones. So, you know, I had a sort of massive spreadsheet that you've got to try and sort of work your way through, and it's just silly little things like that, you know, that apart from the pure emotional support is a very big help. One of the reasons that I did with Macmillan videos and podcasts that we did, one of the reasons for that is that I went through that, and there were various stages through from the initial diagnosis through really to now, and I'm 3 years out nearly from the end of treatment. There were various things there that I wish I'd known. I wish I'd known then what I know now.
Yes,
and that's why I do the work that I do, to try and sort of put that lived experience across to people, because it's not as frightening as it appears when you first go into the oncology waiting room.
Right, that's
because,
really important, isn't it?
There are stages that you need to go through. The more you can be prepared and ready for those stages, the easier it becomes, I think.
I suppose it's having that information, isn't it, and that knowledge, whether it's from Maz or it's somebody with lived experience. That's important information to pass to other people who may be starting out and have just had a new diagnosis. Just have that support and that information from somebody who knows.
Yes, because your own brain, your own mind is inevitably quite scrambled in those early days. So the more you can have a sort of have some steps charted out for you, I think it does make it easier.
I mean, you mentioned about the spreadsheet and all your medication. I mean, that's very important, is it? You sort of termed it as perhaps something that's silly, but actually it's really important, and it's something that helped you, that might help other people as well, so that they can navigate their medication at the times that they need it, and when it's really quite a key sort of, I guess, something to support people with, isn't it? To have that information.
Yes. In effect, I was living my life in 15-minute chunks, and that can, that can really
take over, can't it?
Can get you down if you're not careful. Yeah. So it's just, and again, knowing it's coming is makes life a lot easier if you know what's coming.
Yeah.
The printed information that you get says that things should start to improve with taste coming back and that sort of thing, and ability to swallow should start to come back after 2 weeks. Normally it's 6 weeks. Sometimes it might be as long as 12 weeks. On very rare occasions, it's permanent. Okay. Well, as I went through 2 weeks, 6 weeks, 9 weeks, 12 weeks with some improvement, but not all the improvement I was looking for. From 12 weeks onwards, I was terrified. I was thinking, this is going to be permanent. It actually takes probably a couple of years, probably 2 years to come through. If I'd known it was 2 years in advance, I would think, okay, 2 years is okay. Suck it up. I'll just get on with that.
You're right. We need to give the right awareness to patients and be realistic. We normally say it's about a year to year and a half that you get recovery, because after that you don't really. Some side effects don't recover, because there is an element of like the dryness of mouth. There is an element of permanent, because the radiation does damage the salivary glands. Same as the taste buds. You don't recover all of them, especially if you have chemo and radiotherapy. So yes, I do agree.
So you talked about managing expectations. Is there any other things that you'd perhaps wish you'd known?
The time of the actual treatment itself, which was about 6 weeks, I guess, to put together. Particularly given the fantastic unit in the Luke Centre, because you were the centre of attention for absolutely everything, and you were surrounded by this fantastic comfort blanket. And I've got no criticism at all of anything there at all. It was absolutely brilliant, but that comes to an end. And it's a cliff edge.
Yeah. We very often hear that. Yeah.
So your comfort blanket is taken away. That you've still got the emergency assessment bay and that sort of thing, which is great. That's great as a safety net. But again, I think had I known that, it would have been a bit easier.
Yeah.
If I know something's coming, then you can handle it.
Yeah.
That much more easily.
That is quite a common thing that we hear.
It's a fantastic. The time that you're having your treatment, you're the centre of attention, and it's really, really good.
What sort of things did you do, Mick, when you sort of felt that you'd come to that kind of cliff edge and that comfort blanket had gone? What sort of things did you do after to try and adjust to not being part of, having to come into Luke and have those people around you all the time?
It became that is really when your sort of personal support, your close family support kicks in, and lots of people came round. Lots of people came round to see me during that time.
Maz, in terms of sort of it being Head and Neck Awareness Month, are there any key messages that you would want to say to people who are perhaps unsure, or even people who have just had a new diagnosis?
Like Mick mentioned, like obviously you get your diagnosis in February, but for a few months before you've got some symptoms, I would say any symptom, if it lasts more than 3 weeks, get it checked out. Even if it's just you've had a cold and you've got that little lymph gland which is not going down, get that checked out. If your soreness of throat or a cough is persisting over 3 weeks or more, get that checked out. Even if it's the voice is changing, people sometimes think, you've been to a concert or something, you've been shouting, but then you should recover in like a couple of days, and it doesn't. We don't think about those things. I think we always think, there's always an excuse why we don't go. That's what I would say. More than 3 weeks, any symptom.
Get them checked out. No, that's great. Mick, is there any sort of key? You've talked about as sort of earlier about the lymph nodes, and Maz has obviously said about that as well. Is there any other key messages that you'd want to say to people who are perhaps going through treatment now, or people who've come to the end of their treatment, or sort of looking for that glimmer of the end of treatment? Is there anything that you would want to say?
I had 6 weeks between diagnosis and the start of treatment, and given the way the treatment goes, the first couple of weeks of the treatment, you're still just about okay, and you can eat, etc., etc. So I had about 8 weeks where I spent a lot of time just really sort of chasing things and trying to get things in place. A key message that was given to me at the beginning was, if you smoke, stop smoking. I don't. If you I don't smoke, so that was the problem. If you drink less. Well, I don't drink alcohol anyway, but eat well and do plenty of exercise. Now, those are 4 things that the NHS has been saying to me for probably getting on for 70 years. And that's my biggest regret, particularly on the exercise. I didn't exercise. During the treatment, I think I lost just over 20 kilos. Right. But it all went from my legs and my arms and my shoulders, and I still haven't managed to get that back 3 years. 3 years in.
Right.
So I was involved in the pilot for the prehab, Macmillan prehab session, and did that as a bit of rehab, and that is a fantastic thing to do. And so, if you ask me what my biggest regret is that I didn't listen, and I didn't spend that 6 weeks building up my strength and building up my exercise. And I'm 3 years after, I'm still regretting that. So that's a big message.
Big message. Okay.
Which I think you would support.
Yeah, definitely. In those 6 weeks, people, I always say, do as much as you can, carry on life like normal, but get the exercise in, because when you do lose weight, like Mick says, it's not just about losing weight. You don't think you can lose it from where you want to lose it. It's muscle mass you lose. It's that strength you lose. That's why if you're going for gentle walks or a little bit of cycling, that does help.
Just to keep building it up, either maintaining or just to keep building it up.
And unfortunately, my prize-winning stomach remained throughout. So.
Well, thank you to you both. It's been really great to speak to you, and thank you for sharing your experience with us and sort of letting us into the world of Consultant Therapeutic Radiographer, and really appreciate that. So thank you.
Thank you.